Development speaks for itself. The many times you're probably going to see the CS and think it's all about PR. It's because she is confident that what she is doing and what the Ministry of Health is doing is in good for the people of Kenya. Do you suppose that is the case? Of course, the lines are open for you to interact with us. Once again, Mary Muthoni, that is Principal Secretary for Public Health and Professional Standards in the Ministry of Health. Thank you so much for creating time. Mheshimiwa, this evening we focus on policy development. We focus on preventive and promotive health services. We focus on healthcare workforce. We focus on food quality as well as the question of nutrition, health research, quality assurance, and not forgetting the numerous bills that have been presented to make sure that the above mentioned are, seen to fruition. The reason why I pick these particular areas is simply because they sit within your very docket, because we understand that the Ministry of Health houses two different PSs. We are going to focus on you tonight. And even as we speak about the numerous strides that we have made in the health sector, the quality of health and patient safety bill comes to question at this very stage when we're talking about, the concerns that we get to witness in the country. A latest case, of course, we do not forget the occurrence that is playing out in the Kenyatta National Hospital. Is there anything you can say in relation to that, putting in mind that this is not the first time this is happening? And amidst all this, there are lots of secrecy shrouded into the activities down there. What's even worse is that we look at a facility that is huge, that houses the East and Central Africa, yet we are told that the CCTV cameras are not functional.
Thank you very much, and thank you so much for having me tonight. First, I want to correct that I am a PS. So I'm the Principal Secretary,
right,
for purposes of those who have listened to you. And before I delve into that question of Kenyatta, I want to first say exactly what my State Department does, what I am, what's my mandate that is in that State Department. And the first on the list is the public health regulation and policy implementation. Anything to do with policies around public health.
Right.
We are the ones that we develop and we are that are related to public health. Number two, coordination of disease prevention and controls. That is still within our mandate in regards to public health policies and managing health emergencies. Then the second one, which is standards and quality assurance. I know you've touched around that.
Yep.
It is also our work. So we establish standards for health service delivery. We equally monitor and evaluate them. All healthcare facilities, we are able to assess them. Then number three, regulation of healthcare professionals. We register them. We license them. And that is why we have KMPDC, the Kenya Medical KMPDC, Kenya Medical Practitioners and Dentists Council. We have Poisons Board. We have Nursing Council. We have COC, the Clinical Officers Council. So we register them and we also license them. Again, we also are able to ensure that the professionals conduct their businesses in an ethical manner.
Right.
That is why even in SHA we have introduced a code whereby if you're a medical practitioner, a doctor, and you're going to operate in a theater, then you're able to enter your code. We will know it is Dr. X who is operating patient Y. Then again, we are also in charge of training and capacity building.
Right.
We have our premier mid-level college, the Kenya Medical Training College, KMTC. So we support continuous development and training of professionals. Equally, we have postgraduate on needs basis. When counties, maybe you need an obs-gyna from a certain county, then we are the ones who take them for training.
Right.
Again, we are in charge of collection of data, surveillance, and any data management. Remember, data is useful and very critical in regards to planning, And this data that we collect through surveillance, we are able to plan better. We are able to know how much money we request during budgetary allocation. And finally, health promotion and education, which is also very, very critical. The Bible says, your people will perish for
lack of knowledge.
Lack of knowledge.
It's true.
So we must keep the people knowledgeable at any given time. Keep telling them to wash their hands. Don't assume that it's something which is very easy and something that they will remember.
Okay.
Just remind them. So I thought it's good I put that into perspective on what my State Department entails as we delve deeper into, indeed, what have we been able to do around.
Hence my question.
Around that.
And I think I highlighted this that you have talked about, yes.
Yes.
On the quality.
So you started on the quality of care.
Yes. And the health and patient safety
bill. I had put for you some few notes which I'll leave with you because we are in the process of public participation.
Right.
And I would want to convince you why we really need the quality of health care and patient safety bill 2025. When the government came into power, Kenya Kwanza government, the first thing that we did was to come up with acts that are aligned to facilities, you know, professionals, but we forgot the patient. You know, we forgot the patient. And that is why it is very, very important to ensure that we establish a comprehensive legal framework to enforce standards on quality of healthcare across all sectors, whether private, public, or faith-based. The way we treat our patients, it should be standard, and it should be entrenched in the law. Many a times is when I look into the media and I feel so sad when patients have to record themselves and send videos, you know, so that they can get justice. It shouldn't be like so. It should automatically be, there is a legal framework that tells you if you're mistreated in a facility, this is where you report, and this is what will happen. Then the second one, we want to establish a national authority that is going to regulate the quality standards, monitor compliance on those facilities, so that if we know facility X is mistreating patients, then we have the authority to go and reinspect or even revoke their licenses. And we also have that authority that will accredit the license, they'll inspect, and they will also be able to rate the health facilities. We will be having maybe 5-star facilities, you know, depending on the rating that you have been given, just like hotels, the way they do it. Then the other thing is the standardization and accreditation. We have our KMPDC that has been licensing and accrediting at the same time. Now, you are a doctor, all right? You have a facility. And there's this institution that licenses you, accredits you, and does everything. There's conflict of interest, of course. So we want to separate that and ensure that there's uniformity in the way accreditation is done, and there's national quality standards for registration, for licensing, for accreditation, for inspection, and categorization of facilities. We have seen facilities that are level 2 operating like level 4. And those are the ones that make patients die on the patient's bed.
Until then, Madam PS.
Yes.
Because I'll find myself calling you CS so many times, and I'm telling you should be saying amen to that. Something must surely be happening, because until the bill is passed and assented to law, we still are having these concerns that we're talking about. Hence my question, on how best we can ensure that there's safety in hospitals, both for the workers and the patients. The question of compliance still becomes a problem, like you rightfully admit that you'll have a level 2 hospital that is acting like it's a level 4. Hence, the reasons why we have some of these problems. We still have queries on the question of compliance, especially with public standards and professionalism. And of course, on the question of the health workers, most of the fingers are pointed to them, because then we get to see these problems. Until the bill, is successful and assented to law, what is happening?
You see, it's not that we are not doing something. There are already institutions that are mandated to do that.
Right.
And I'll keep mentioning our KMPTC, the Kenya Medical Dentist and Practitioners Council, which is mandated to inspect, accredit. But we have realized there could be conflict of interest in the process, and that is what we want to sort, to separate issues. If it is licensing of healthcare workforce, it will be done by a different institution. Accreditation and inspection of facilities, then let it be done by somebody else different, so that we don't have to mix all this, which is bringing a bit of problem. We already have institutions that are in charge of healthcare workforce. The doctors have their KMPTC. The nurses have Nursing Council. The clinical officers have the Clinical Officers Council. And any other cadre, they also have their own councils, including Nutrition Council. So coming back to the facility, I know I may not want to delve into that case, because it's already a case under investigation. Right. And it would be very disrespectful if I start discussing matters of security in a national TV when we do not have the report. I would ask you and our viewers to be patient so that we can get the report, and then we can be able to discuss or dissect what went wrong, what can we do moving forward.
Okay.
Yes.
If we, before we leave this space where we're talking about the safety as well as the quality of healthcare, just how deeply engaged are the unions, as you have mentioned, in terms of forming this bill, or perhaps in terms of, just giving proposals or them voicing their concerns? Because it's one thing, and it's very common, especially with the health sector, where, we get to see policies that have been projected, and then later on, you invite these unions, you invite, health specialists on board, and they're like, we said we gave our proposals, but, the ministry decided to just sweep them under the carpet. So how involved are they, and just how much can you guarantee them that their proposals are going to be put to consideration? No,
we are working very closely with them.
Okay.
In fact, the last meeting was between the Ministry of Health and the healthcare cadres, and we are in agreement that we need this bill. We need to move forward. We need to protect the patient. You see, just like we are talking about, I know you have seen on TV recently when we are talking about bed capacity, that we have facilities who are registered as maybe a level 4, and your bed capacity is maybe 300, but your admissions go up to 1,000. You see, so that means there are people who sleep on the floor. So these are the kind of standards that we are talking about. I don't think you will be happy if you went to a facility and found your mother sleeping on the floor. And probably that facility will still charge SHA to pay for that.
And I'm glad that you bring that up, because, of course, yes, the non-bed sharing policy is one of the questions that I wanted to ask tonight. So how does then the ministry intend to build capacity, that is at both county and national hospitals, to ensure that the policy is enforceable across, even though we understand that health is a devolved function? Just how are you working in synchrony with the counties?
We do not have patients for counties and patients for national government. A patient is a patient.
Okay.
And when you talk about the roles of national government and county government, they are very clearly stipulated. The national government role is to develop policies and training, and the counties implement In fact, most of the facilities are at the county level. So implementation works there. But we still have the role of oversight. We still have the role of inspection. We still have the role. So it's up to us to up our game and ensure that those facilities are meeting the standards. And if they don't meet, then we close them.
Okay.
It's as simple as that. But so far, so good.
So far, so good.
So far, so good. I know you want to know, and you gave me this at before we started, and
right.
you wanted to know what exactly have we been able to do for those 3 years that we have been in existence.
Hold it. We're going to come to that. But we're going to come to that. We really are going to come to that. So I want us to ask this question, which is in relation to what we've just discussed.
Maybe the questions you're asking me are going to be answered by that.
But you know now.
So you'd rather allow me to talk and tell you,
no,
and then you can ask me the question.
It's a question answer affair. I'll come to that. You see, they say that many hospitals, because we're talking about beds, I don't know whether you're alive to this reality, that today in many hospitals, you see that the beds are empty, it's vacant because the patients cannot afford. And I really wanted to avoid the question of SHA, but you have mentioned it a couple of times. The president today has spoken about the fact that SHA is working. I don't know whether that's the report that you're giving him and whether this report resonates to what it is that is on the ground. That today we really are seeing patients going home simply because they cannot afford the full 1 year payment of SHA. My own mother sent me actually not sent a message before she even knew that I'll talk to you. She was like, well, this 1 year thing, you know, sometimes you pay for different people who are actually not working. How are we going to make sure that we keep this money until we make an annual payment? You know, most of us, you know, are hand-to-mouth kind of people. So when you get your 300 bob, your 500 bob, you want to remit it almost immediately. When you're trying to remit, you're told you cannot do that. You need to do this annually. How do we ensure that, you know, the patients do not end up suffering at home and that every other Kenyan, regardless of their levels of cadres, or, you know, are met, their concerns are met?
Thank you for that question. And I want to confirm to you SHA is working.
Okay.
And if we have to go granular, we need to go to specifics. That so-and-so went to this facility, the facility's name is this one, and this is the experience. Secondly, we listened to the pain of Kenyans. Even that 1 month paying, some people could not afford. And that is why we introduced the SHA, lipa SHA pole pole.
Okay.
Many patients would go to hospital. Maybe you're from Mjengo or Mamamboga. You know your money comes on a daily basis, depending on the sales. So they would go to hospital. You are admitted first month. You had paid for just that 1 month, but you exceed the number of days you expected to be there. Maybe you stay for 2 or 3 other months. By the time you're released from the hospital, you have a bill. Because one, your SHA is not updated at that particular time, and you're still in hospital. So you start to kuchanga, you know. So that has really given us a push to help the patients, to help the citizens, to be able to pay their annual pay pole pole.
Is this practical?
And this is,
Are they well aware about it?
It is very practical. Probably we may not have given the enough information of how it should be, and that is the sensitization that we are doing. And that's why I'm here today, to also explain to Kenyans what this lipa SHA pole pole is. That if you cannot pay your 3,600 at once, then the government has given you somewhere to get some money from Hustler Fund, the 3,600, so that you can start paying monthly depending on your ability.
Why must it be coined with Hustler Fund?
I mean, it is just one of the sources.
Okay.
We could be having many others that are coming on board. In fact, we've already approached many other financial financiers who can be able to also offer their products in the SHA. So if you feel that you want to get the money from a certain bank, which will be in that in that line, then you can either pick from Hustler or any other.
So this is going to be a loan?
No, it's not
because
alone.
What is Hustler?
It is not alone.
Okay.
This one is not alone.
Okay. This
It
one you
is
just go there?
interest-free.
Interest-free?
Yes.
Okay.
You know, Hustler Fund and SHA are two different things.
Yes.
Okay?
Yes.
It is only that Hustler Fund has money which can
help you fund
fund people who, so that they are able to pay for the whole year. All right? And it is interest-free.
Okay.
Nobody is going to tell you to pay one more coin above what you
So what are you telling this Kenyan who says, I can always afford to get my 300 bob every month and pay it comfortably? What are you telling them? It
what
must
I'm
be
telling
an annual
them,
affair?
What I am telling them is that the
Go
money,
to the Hustler Fund?
you can go to Hustler Fund, you can be given that money.
One time?
And then you'll be paying the 300 the way you wanted to be paying per month.
Okay.
But you'll be now be returning the money that you have been given.
What does this
It's
mean
as
to the
easy
old
as that.
mama who is in the bundus, who is just worried about their condition and must always make these payments for sure? What happens to them? Because you see, we're talking about universal health care.
Yes.
I don't know whether you people have factored in the importance of this. I mean, to this old woman who has always known that my style of payment is this, it's this, it's this, it's this. How do you religiously get them off that space?
You see, if even me and you, if you're able to pay for a whole month or for a whole year, and you don't have a problem, remember, you're not actually just paying for yourself. You're paying for you and your family.
That's true.
Because SHA is covering for you. If you're a man and you're the one who is paying, then put your dependents plus your wife. Okay? And if you're a lady, then you will put your husband plus your children. So again, this is a matter of sensitization, which is now upon us, to go down and really explain to the public why this is very important.
And very critical. Yeah?
Very critical
yes,
for them.
It's very important.
Because you do not want to receive calls on your phone from your mom, as you have told me, because probably her SHA is not updated for that 1 month, okay? But if you are able to cover for the whole year, and this time the government is telling you, here is the money.
Okay.
We will give you that money that you don't have. Okay. And you can be paying that 1 month to return that money that you did not have.
What difference, Mheshimiwa, if I'm going to just submit my payments on SHA?
My dear.
You know, because if I'm going to take it from Hustler, and then every month I'll have to be making the payments, it's the same thing as just paying.
Those are two different institutions.
Okay.
And this is insurance. You know, the stability of SHA is dependent on me and you.
That's true.
Okay?
So if the money is
so
remitted,
if you do not pay, how will we do the capitation for the facilities?
Fair enough.
And the primary health care, which is free for you.
All right.
And me.
Some civic
and
education.
my mother.
Some civic
all right?
education from
that is why I am here tonight.
Thank you.
Because
allow us to take a short break. Allow us to take a short break.
The minute I convert you, you have allowed...
I have the capability to
You have the capability to actually tell Kenyans on a daily basis what I'm telling you.
Okay.
And I'm here to tell you facts. Right?
Fair enough. Allow us to take a short break and then we come back on that note.